Hi, my name is Lori Hecker. I'm a faith community nurse, and today we're going to take a few moments to review culturally congruent practice for the faith community nurse. I want to take just a moment to point out that Health Ministries Association and the American Nurse Association have developed standards for faith community nursing, and we're going to focus on that today, as well as talk about some practical strategies that will help you in your practice. Our objectives specifically are to explore the Health Ministry Association and the American Nurse Association faith community nursing scope and standards. We'll define culturally congruent practice, the implications for faith community nursing, and then we'll look at a few practical strategies to help us be culturally congruent in our care. As with anything, we need to think about the foundation and where we started in our practice. What are those things that give us our foundational knowledge? Think about the mentors that you've had in your life that have given you examples of what a good nurse looks like and what a faith community nurse does. We look at the Franciscan values and that of respect for life. And it's defined here that the gift of life is so valued that each person is cared for with such joy, respect, dignity, fairness, and compassion that he or she is consciously aware of being loved. You also consider the life of Francis of Assisi. Certainly he healed lepers, he worked with the medically underserved and the disenfranchised, and that's a lot of what we do as a faith community nurse with whole person care. Now, each of you should have a copy of the Health Ministries Association publication of the Faith Community Nursing Scope and Standards of Practice. This happens to be the third edition that was published by the American Nurse Association. But a couple of things that I want to point out in this document, if you don't have it already, you can get a copy at the ANA website, or you can reach out to your parish nurse coordinator or facilitator to see about getting a copy. But I want to point out that the ANA definitely recognizes faith community nursing as a nursing specialty. And it tells us that this specialty, we acknowledge spiritual care as an essential component of specialized body of nursing knowledge and competencies. And so we're looking at individuals, families, groups, and communities, and looking at whole person health. And that's really unique to faith community nursing. The standards that we're going to review today in this particular document, there are multiple standards, but we're going to focus on just one. And within that standard, there's multiple competencies, and we're going to review that together. So what is culturally congruent practice? Well, you can see here in the illustration, it's a multitude of things. The definition specifically is how culture refers to the learned, shared, or transmitted values, beliefs, norms, life practices of a particular group. And all of that guides thinking, decisions, and actions in a patterned way. Culture sometimes needs to be understood through cultural knowledge, awareness, encounters, and skill. And then we integrate all of this knowledge into practice so we can assess and provide really skilled care for members of a variety of racial, ethnic, or social groups. This expertise requires that the nurse has self-awareness of their own personal cultural identity, heritage, and values, and engage in lifelong learning, such as listening to this course, or really immersing yourself into a variety of cultures just to learn more about them and what is important to them. Further, we also think about culture that is incorporated by folk medicine practices and faith healing. We think about the Hispanic theory of disease, where ailments are thought to be developed as a result of an imbalance between humors, hot and cold. So that means then remedies, medications, and foods are assigned to those descriptors. Other things to consider with culturally congruent care is, children that no longer live within their dominant culture may sometimes have conflict and kind of living a balance between two worlds. And how does that affect their decision making? As faith community nurses, we're going to be an advocate for these folks and look at levels of care that are culturally diverse and specific to vulnerable populations with limited access to healthcare resources. We're going to advocate for this care so that we can improve access to care, promote health, positive outcomes, and reduce those disparities. And we definitely want to be aware of the impact of discrimination with and among vulnerable culture groups and advocate for culturally sensitive care. Here's some interesting facts you may not be aware of. The composition of Indiana: 83% white, 9% African American or Black, 6% Hispanic, and less than 3 or 4% of Asian, Native American, or Native Hawaiian or Pacific Islander. And I thought it was interesting that there are 14,000 Burmese Chin refugees living in the central Indiana region, and that was back in 2017. So that definitely impacts our practice here locally. Now let's take a little deep dive into Standard 8 of the Scope and Standards for Faith Community Nursing. Standard 8 is defined as the faith community nurse practices in a manner that is congruent with cultural diversity and inclusion practices. So we're going to take a look at the 13 competencies that are associated with this standard. The first one is demonstrate respect, equity, and empathy in actions and interactions with all healthcare consumers. This is really seeing a person for who they are, that whole person care. I see you. I recognize you. I want to walk beside you and help you with what's happening in your life. The next one talks about participating in lifelong learning to understand cultural preferences. Sometimes it's about taking courses like this, like I mentioned before, immersing yourself in a culture, taking a trip if able, conferences. But sometimes it's about just asking your clients what's important to them, what are their preferences, what would be important for us to know that would impact your care today. I think this one's really important as well. Create an inventory of one's own beliefs, values, and cultural heritage. I think we need to be aware of who we are and where we come from, and maybe some of those unconscious biases that we are not even aware of. Sometimes beliefs of other cultures may directly conflict with our own, and how do we handle that in a way that is culturally congruent and still provides excellent care to our churches and parishes and congregations. The next competency is about application of knowledge of variations in health beliefs and practices, various religious tenets and communication patterns in all practice activities. So this one makes me think about eye contact in some cultures where, direct eye contact may be considered appropriate, and yet in another culture might be considered very disrespectful. And, communication might vary as well, especially in end-of-life care. Some groups may not want to talk about end-of-life decisions because it's considered taboo, and how we go about these communications is very important. This is about identifying the stage of the consumer's acculturation and what those needs are. So, you think about the Chin Burmese, they've been in the central Indiana area about 20 years, and so, we could be a second generation Chin Burmese that has a whole different type of cultural need versus someone that just arrived within the last 6 to 12 months, how they're navigating the healthcare system and what their community of support is. But identifying where they are in that stage would also be important for us as faith community nurses. Consideration of the effects and the impact of discrimination and the oppression on practice within and among vulnerable culture groups. And certainly in 2020, there's a lot of movement and discussion about discrimination and oppression, and a variety of opinions about the impact of that and how that impacts healthcare. But sometimes it's the client or our parishioner or church member that has their own thoughts about this and how they approach their healthcare based on their perception of these things are also important to consider. You may not think it's discrimination, but to them, maybe it is. And so those are good questions to ask. This particular competency talks about using skills and tools that are appropriately vetted for the culture, literacy, and language. I know within this Franciscan group, the marketing department helps with a variety of educational materials that are published in multiple languages. But we also need to be sure that these are vetted and appropriate for the level of literacy for the particular group that we're trying to reach out to. And again, the best way to find out is to ask and get involved with that group. The next competency is about communication with appropriate language and behaviors, with including the use of medical interpreters. And so with Franciscan Health, there is interpreters available through what's called the language line, which is a telephonic service that's available for employees. If you're not an employee of a hospital system that has interpreters, it would be a good question to ask of your church leadership and parishes and local regions to see, are there medical interpreters? And if not, how are you going to imbalance that and making decisions about whether or not it's appropriate to use family members in some discussions and situations. So certainly there are availability of brochures and things in different languages, but how we use medical interpreters would be something to consider. Identification of the culture-specific meaning of interaction, terms, and content. Again, asking questions about who is the go-to person in the family. For example, you may be talking to a female patient or client, and maybe in their culture, the male should be consulted first, or maybe a father figure or a grandfather figure might be the one that needs to be addressed in some of these important conversations, even though the patients should be making decisions. But having a conversation and asking questions about what about your culture would be important for us to know as we engage in this conversation. Respect for consumer decisions based on age, tradition, belief, family influence, and again, stage of acculturation. And I think, again, that has to do with age-related decision making. You may have a patient who is adult, maybe in their 20s, but they, based on the tradition, would still seek an elder in their ethnic group to help make decisions. So their family may have a huge influence on what they're going to be deciding related to their health care. Advocacy for policies that promote whole person health and prevent harm. And this is really important as faith community nurses, because maybe you need to advocate for a policy that promotes outreach into a ethnic minority group within your church or community or congregation. That may be on the church level, it may be on a state or local level, where you're looking and identifying needs and advocating and being a voice for those that are underserved and underrepresented. The next competency here is about promoting equal access to service, test, and interventions as far as health promotion activities. And these things, again, just making sure that these activities are advertised in such a way that would reach a minority group, that it's translated appropriately in the correct literacy level, so that we're not speaking over or under the literacy level of that particular group, so that they have every opportunity to participate in whatever activities you may have happening in your congregations, churches, and parishes. And our last competency here is about educating nurses, colleagues, and other professionals about cultural similarities and differences of healthcare consumers, families, groups, communities, and populations. And so I think this is important as we think about what faith community nursing is, and that whole person care and that attention to spiritual care, and looking at your specific community, identifying what is that minority group, reaching out to nurses that may be a part of that group, and then mentoring them so that they can become faith community nurses and continue to do this good work that we're doing. I do want to point out within the scope and standards, there are additional competencies for the graduate level prepared faith community nurse, as well as the advanced practice faith community nurse. And with the graduate level, the summary of those 5 competencies have to do with evaluation of tools and instruments, organizational policies, research, and dissemination of research. And then with the advanced practice faith community nurse, this is about shared decision making and planning, prescribing, and evaluating processes such as a diagnosis that may impact that healthcare consumer, and the cultural preference may impact that as well. So how do faith community nurses advocate for culturally diverse and vulnerable populations with limited access to resources? Well, a couple of things I just want to point out is that the definition of cultural knowledge really is about the concepts and language of an ethnic and social group that they use to describe their health-related values, beliefs, and practices. as well as maybe the etiology of their concerned or preferred treatments, and any contraindications that might go against either their culture or ethnic group by tradition. Historical events, sometimes such as war-related migration or oppression, may cause some structural discrimination. And just like with the Chin Burmese population being the religious refugees that were persecuted and have fled, and now located a large group of them here in the central Indiana region. We can also advocate by increasing our knowledge and skills, our integration and expertise in practice. No, each one of us, we can't be an expert on all cultures, but I think it's important just to open up and look around and see what minority groups might be in your communities and finding ways that you can reach out to them. As we conclude our time together today, I want you to consider the following. How can you be a mentor to someone else? Think about the mentors that have helped you along in your career in faith community nursing. How can you educate others about the beautiful and holy work that we do? Look at your communities. Look at your churches and parishes and congregations. Are there minority groups that are underrepresented? Can you identify a nurse that belongs to that minority group? And perhaps be a mentor to them. Have a conversation about how they might get connected with this faith community nursing group. Tell them about your experience, how you've helped others, what your passions are. Get them connected with a core curriculum in faith community nursing that might benefit their practice. But overall, just be an encouragement to someone else so that we can all walk the walk and be culturally congruent in our practice and promote health in our communities. Here's a few resources for you. I hope you enjoyed this presentation. Thank you for your time.